A minibus transporting medical professionals working with the U.S. humanitarian organization Project Hope passes destroyed apartment complexes here in the Donetsk region of Ukraine. Doctors are headed to a clinic in Liman, one of the frontline towns where dozens of patients await their arrival. Retired resident Serhiy Mishin needs to see a cardiologist. He hasn't seen one since Russia invaded Ukraine in February 2022.
I've been sick since 2002. I had a heart attack. My health hasn't been great. My blood pressure is either too high or too low. So I wanted to see a doctor about that.
Next door is the office of otolaryngologist Dr. Alexander Minaev and nurse Tatiana Tkachova. Every day they see up to 30 patients here.
Anton, the boy, is 12, and in all those years he hasn't breathed through his nose normally. I don't think he was ever really helped.
Anton's mother Ludmila, who didn't want to provide her last name for safety reasons, says locals cherish these doctor visits. For them, it's incredibly convenient.
Yeah, we stood in line for a bit, but we didn't need to go anywhere on a bus or anything. We used to need to go to Slavyansk, all the public transport, and then lines at the clinic.
Doctors from the city of Kramatorsk are among those who could come to the Donetsk region thanks to Project Hope program coordinator Yulia Dimnich. Originally from Donetsk, Dimnich moved to Kramatorsk in 2014, and after Russia invaded Ukraine, to Dnipro. When she comes to Kramatorsk for work, she stays in her old apartment next to Ria Pizza, a restaurant Russian forces shelled in June 2023.
I'm just angry, you know? They just make us hate them more, but they're not going to scare us.
Dimnich has worked with Project Hope since the start of Russia's invasion. After the war started, the charity opened an office in the Donetsk region.
Donetsk, Zaporizhia, Dnipropetrovsk regions, also regions like Nikopol, which are constantly under shelling. So we basically always work under fire, you know?
We help in various ways. We also help locals by providing them with fuel briquettes, hygiene kits, bottled water, and whatever else is needed at the moment.
After the war ends, Dimnich hopes to return to Donetsk. Her older son was born there. Her younger one was born in Kramatorsk. So far, Project Hope has put together 46 mobile medical teams that help residents of remote and frontline villages and towns who cannot make it to a clinic. In the 2.5 years since the war started, its doctors have provided medical help to over 24,000 people in the Donetsk region alone. Overall, the organization has provided locals with medication and medical equipment worth over $12 million. For Yaroslava Movchan in the Donetsk region of Ukraine, Anna Rice, VOA News.